morning, everyone. I'm Kim McCleary, President and CEO of the Los Angeles World Affairs Council and Town Hall. It is now my great pleasure to introduce today's program, Safer at Home, on LA County's plans to gradually phase in its reopening. Joining us for this webinar are Los Angeles County Supervisor and Board Chair Kathryn Barger and Dr. Barbara Ferrer, Director, LA County Department of Public Health. Today's program will be moderated by journalist and LA Magazine contributor, Jon Regardie. Thank you all for joining us. And now, Jon, it's time for me to turn it over to you. Good luck.
Thank you, Kim. And the first thing I'd like to do is say thank you to the Los Angeles World Affairs Council and Town Hall. At a time when we are necessarily physically distanced, it would be so easy for our lines of communication to break apart. But the webinars you've been doing help keep this community not only together, but also informed. Los Angeles is fortunate to have your organization. And I would also like to thank two people who I think everyone watching today is deeply familiar with and who have been stalwart leaders as the region has confronted the coronavirus. We're joined by 5th District County Supervisor Kathryn Barger, who represents an area that measures 2,800 square miles, including 22 cities and 70 unincorporated areas. And we were also lucky to have Dr. Barbara Ferrer, Director of the LA County Department of Public Health, who's in charge of keeping the 10 million residents of LA County healthy. You both have a lot of demands on your time, and we appreciate you being here today. I want to start by being as up to date as we can. In the last 10 days, we've seen a relaxing of the Safer at Home order, with curbside pickup now available at most local retail stores and limited use of beaches, trails, and recreation facilities, though maybe not much in today's rain. Supervisor, what are you seeing in the public's initial response to these moves? Are people responding and behaving in a responsible manner, given the continued severity of the crisis?
Absolutely. I mean, when we first put into place Safer at Home, the trails and the beaches were open. And what we saw was people did not really understand social distancing, the importance of wearing a mask when you're in an area where there might be people. Now, with the trails reopening, we deployed staff to all of our trails to help with crowd control. I've seen firsthand individuals understanding that you have to have social distancing and wearing masks is important. So I think we've come a long way in almost 2 months of having Safer at Home in place. We have a lot more work to do because as people get anxious, they want to get out there and we cannot let our guard down. But I've been very proud of the residents of LA County for their response and their understanding using common sense when you talk about the ability to go out and go for hikes, go for walks, go to essential services, but also practice social distancing and actually just being safe.
Excellent. Dr. Ferrer, I want to ask you something with a spin on the same question. You've pointed out many times that this virus is no less dangerous than it was several months ago. Does the data tell you that we are adequately and collectively learning to live with this as part of our lives? In other words, is the public taking enough precautions, the distancing, the donning of masks, to allow us to keep moving forward without having to revert, at least temporarily, to those earlier stay-at-home stricter restrictions?
You know, I 100% agree with the supervisor. You know, we're only where we are today because everyone did their part. And we'll continue to make progress on our recovery journey because I have a lot of faith that everyone will continue to play their part. You know, sometimes as you reopen, it's harder because we absolutely have to explain to every sector as they're reopening, what can you do in your place of business that makes this as safe as possible for both your customers and your employees? And we have to do the same with people who are out and about more. You know, what is it that makes it so important to put on that face covering? You know, it's not intuitive. And everybody remembers that when we started this journey back in February, we didn't think that people needed to wear face coverings. So we've got to continue to remind people as we've learned more about this virus. We found out that not only is it easy for it to be transmitted, but unfortunately people with no symptoms transmit this virus, and that makes it so important. The one thing you can do to protect somebody else, because there's so little we can do, is to put on that face covering and keep your distance. So when you're out and about, and we're glad people are able to be out and about again. This is a beautiful county. We want to make sure as many people as possible can get out, but we need everyone to take the responsibility to continue, do your part, put on your cloth face covering, keep your distance, protect our workers so that they don't get sick, and we'll continue to be able to reopen different sectors, you know, over the next few weeks. So yes, we're all anxious to be out and about and to be on a recovery journey. And that only happened because everybody was so great about doing their part.
Perfect. And a reminder to all our viewers out there that you can type in and send in questions. We will be taking those later in the day. Supervisor, we know the tremendous economic toll that this is taking on us, particularly the huge spike in unemployment. We've heard estimates of unemployment being near 25% in the region. And it seems pretty clear that many of those jobs won't be coming back in the short term. What do you see as the key steps that the county and your fellow supervisors can do to help the people who've lost their jobs but still have to pay rent, still have to buy groceries, get clothes for their kids, and everything else?
Well, first of all, Supervisor Hilda Solis and I sponsored a motion, and we've got the Economic Recovery Task Force, which is being developed and is going to actually bring experts and leaders from different fields, different sectors to the table to look at what this county, what the state, and actually what the nation needs to do to support the endeavors of those that are small businesses, the entertainment industry, religious organizations. How do we help you rebuild based on post-COVID-19? And it's important to use public health as a template moving forward, but recognize that we have industries that are struggling and some may not be able to recover. And it's my greatest fear, because really, if you look at LA County, small businesses really are the grease on the wheels as it relates to really what makes this county so diverse and so great. So it's important for us to support them. The county has put together small business loans for businesses. We estimate about 9,000 need them right now. And we're granting about $10,000 per business to try to help them at least get through this time. I know that the federal PPP, Paycheck Protection Program, is in play, and that comes with some challenges for many of those businesses. But I have talked to several that have gotten it, and they feel that's going to be a bridge to at least get them through June. And so it's important for us to work together and recognize that it's not a one-size-fits-all. And we are going to have to think outside the box as it relates to how we are going to support our businesses moving forward. And it's going to be a challenge, but with my colleagues, I'm confident that we will be there to support and not be an impediment to supporting industry.
Excellent. Thank you very much, Supervisor. Dr. Ferrer, I want to go to a different direction. As we look at the numbers over the last few weeks, there seems to be something of a plateau. Hospitals were fortunately never overwhelmed, but at the same time, we've been seeing a fairly consistent number of weekly new cases, often around 6,000 a week or so, and unfortunately, a fairly consistent number of deaths, generally about 300 or so. Obviously, you and the leaders you work with think we've advanced enough to take the steps that we have to reopen these businesses. But given the consistent numbers, are we really making enough progress in our efforts to combat this virus and COVID-19?
I think it's a great question, John. And obviously, I think everybody else who lives anywhere in the world right now wish we had made more progress around, we have a vaccine available pretty soon. We have therapeutic medicines that really can treat specifically the disease of COVID-19. And we have a rapid testing system that gets you both tested easily and gets results, within 15 minutes, because those would all be tools that would make it much easier to, in fact, continue to do a recovery journey. We don't have that. So in the absence of that, what we have is everyone's goodwill and everyone doing their part. And I do feel confident. If we hadn't flattened the plateau, if we had seen a spike, and we didn't have so many people, staying home and using protection when they were out, we would have overwhelmed. We could have overwhelmed. We could have looked much more like what happened in New York City than we did. I think there was swift action that everybody took here. I feel confident because people are doing their part that you can enter into the recovery journey. We have a dashboard, so everyone gets to watch every day the markers that we're going to use to make sure that we can maintain what I call the slowing the spread, because that's what we need to do, and we'll need to do it for the weeks to come. We need to continue to slow the spread. We can't allow for there to be an excessive increase in either cases or people who need to be in the hospital. And worst of all, what we don't want to see is a spike in our deaths.
Great, thank you. And I want to build on that a little bit. The county has a very clear 5-step reopening process, and we're now entrenched in phase 2. Facets of this phase that have not yet reached include the opening of museums and libraries, and phase 3, as you've very clearly laid out for all the county residents, includes movie theaters, schools, bars. I realize that the answer to this may be, well, we'll have to see what the data says, but I'm asking you to look into the crystal ball a little bit. Where do you think we might be toward the middle and end of summer as we get to July, August, September? Do you think we'll be in the later phases of later segments of phase 2, or maybe even into phase 3, opening some of these other aspects of our society? And why don't we start with you, Supervisor?
Well, so, I believe that if you look at the individuals who have been most impacted by this horrible disease and this virus, it's been those in vulnerable categories. I mean, I think, Dr. Ferrer, it's 98% of those that died had pre-existing conditions, and 51% of the individuals that have died tragically came out of skilled nursing facilities. So I believe if we can aggressively look at those populations and recognize that even if we're in phase 3 or phase 4, the vulnerable populations still need to be cautious. They still need to recognize that they are in a population that is vulnerable to this virus. We will be able to move forward. And it's controlling that is really going to allow us to get into the phases that are going to bring us back to something that I tell people it's not going to be normal as we knew it pre-COVID, but normal as it relates to providing opportunities for people to get back out there, purchase goods, and practice social distancing, but in a manner that is going to continue to slow the spread and control this virus.
And Dr. Ferrer, your thoughts on where we might be towards the towards the summer? Could we even be sitting on those beaches instead of just going in the water?
I absolutely think we can. I have a lot of confidence. I've seen amazing people here, both make great sacrifices and also exhibit great acts of kindness. And this willingness to help each other and protect each other, I think, is what gets us to stage 3. So yes, I do think I totally agree with the supervisor. I think we have vulnerable populations. We have to work really hard to make sure that we have a lot of protections in place in the places and spaces where we know there's a higher risk of spreading infections. And then we have to make sure that people who fall into a category where they may have an underlying illness or they may be elderly, that they too have what they need to protect themselves and to stay safe. But yes, I think it's completely possible and highly likely that we're in stage 3 this summer. Absolutely. That would be my guess. And again, it's a guess. We'll have to watch the data, but I think we're doing a good job. And I'm very proud to be here in this county and proud of our leadership at the Board of Supervisors. And I think we've got a path forward, and we're all going to do our part, and we're going to get there.
Excellent. I want to turn a little bit to a personal side. There's no precedent for what COVID-19 has required of you. Dr. Ferrer, you certainly didn't take this job expecting to go on TV each day, having to detail unfortunate death counts and safety precautions. Supervisor, you might have been able to anticipate having to lead the county through an economic downturn or even a recession, but you couldn't have envisioned having to help guide 10 million county residents through a pandemic that has no clear end in sight. Can you talk a little bit about what this is like personally for you and how you meet the challenge of something that we've never seen before? Supervisor, we'll start with you.
Well, obviously this is, when I took over as chair, I had no idea that I would be chairing a situation like this. But as someone who's been in public service for over 30 years, this is really what we signed up for. And it's important to show leadership, but also show the fact that we are going to lead and be calm and provide support and an ear for many, because I've heard from many, many small businesses who are afraid for their future, are afraid that they're not going to be able to make their mortgage, are afraid they're going to have to lay off a workforce that has become family. And so for me, it's not what I signed up for as it relates to good times and bad, but clearly it's an honor to represent this board as chair right now, and working with the great team at DPH and DHS, Dr. Galley as well, Dr. Ferrer. We are prepared to put together a roadmap moving forward, recognizing that the glass is half full, not half empty. I mean, we are all challenged, And it's not just in LA County, it's across the state, across the nation. But I have to say that when you hear people talking throughout this country about where it's been done right, LA County is one of the places that's mentioned. It's because we work together as a team, recognizing that there is going to be a light at the end of the tunnel.
And Dr. Ferrer, your thoughts? Again, this was not something you could have anticipated when you came into this position.
Yeah, and actually, you know, for public health people, we're never in the limelight, you know, and when we are in the limelight, it's because there's often a tragic situation. And so, you know, this for us has been, I think, as Supervisor said, you know, part of what we signed up for, particularly if you're a public health practitioner, you actually train to be able to put up a response for a pandemic. But I think the enormous toll of human life and suffering and devastation wasn't anything that any of us ever anticipated would be the repercussions of a pandemic. And I do agree with the Supervisor that it's an honor to serve. I couldn't ask to be in a better place than LA County. Tremendous leadership, as I noted, from the board, but also tremendous leadership from our community partners, from the businesses. You know, I do these telebriefings with lots of different folks, you know, every day, pretty much during the week, to just listen again. What are the concerns? What are the ideas? And how can we be more helpful? And I think that's what keeps us going. It's we do want to be helpful. We do want to reduce suffering. We do want to make sure that we're paying attention to the vast devastation, not just on people's health, but also on people's well-being. You know, poverty does kill, and we're very much aware that every single decision we make has, at this point, an impact on people's well-being. So, you know, I thank everybody in our county, all of the county residents, for really sharing their ideas, their leadership, their support, and even their criticism of the areas where they're not happy with the directions we're moving, and particularly for those people that have offered us good alternatives. You know, we're grateful for everybody really understanding that we go at this together. And if we go at it together, we do get to the other side. So, but thank you.
Great, thank you. And one other thing that, you know, that reflects a little bit on that and a little bit on something we've touched on a while ago. One of the things that has seemed so incredibly interesting to me about this, and a huge challenge for you, is that, as you mentioned earlier, Dr. Ferrer, things are changing so quickly with this virus. Early on, no one knew the threat from asymptomatic people, and you weren't urging people to stay that far apart. In the very early stages, it was, hey, let's stay 3 feet apart. Now it's 6 feet, if not more. Until April 1st, there wasn't the requirement to wear masks. Can you describe a little bit about what this, you know, sort of the challenges this poses for how you continue to lead and adapt and keep the public trust and adherence high when things are quickly changing? Maybe Supervisor, you'd like to start with this one.
Well, I think that is the greatest challenge, and I think it's been a frustration on my part. I mean, I think if we all had a crystal ball, we probably from day one would have done things a little different. I mean, skilled nursing facilities, Dr. Ferrer has been upfront with the fact that we probably would have been more aggressive in the testing, especially the asymptomatic. And the one thing about this virus is, as you said, we're learning something new every week. And every week poses a different challenge. And I think that the fact that we are transparent about it and recognizing that early on masks were not required because we really didn't know the value of masks. But now we do. And I think that it's a constant challenge. And it does erode public confidence at times because they're like, well, last week you said it wasn't needed and this week it is. But each and every day when we do those press briefings, the purpose of those is to be as transparent as possible and be as honest and vulnerable as possible, letting people know that each time we learn something, we are pivoting and we are addressing that based on what we know today. And that could change next week. And that's why when Dr. Ferrer talks about, you know, hoping to go into phase 3, if we continue down the path we are right now, I'm confident we will. But there are so many unknowns with this virus, which is problematic, especially for those that are asymptomatic. So these are challenges that we all have to acknowledge and acknowledge the fact that this virus is like a virus we don't know.
And Dr. Ferrer, if you'd like to jump in as well, just on the adaptability that you're forced into necessarily.
Yeah, I think the Supervisor, really said it all and said it, well. It's a huge challenge. There's so much unknown. Thankful that people appreciate that when there's so much uncertainty, the best we can do is really offer you some transparency and be very honest. When we get new information and it's credible information, we will need to pivot. I think the issue of having so many people who are asymptomatic, they have no symptoms, and they're positive for COVID-19, that was a game changer. As soon as we got information that not only showed that they're positive, but that they're actually capable of infecting others, and maybe even at almost the same rate as sick people are capable of infecting others, that changes everything for us. And then we have to really look hard at what can we do so that we protect each other, given the information that we have, and in fact, the lack of our ability to test everybody every day. Because that would be, in this time of uncertainty, when you actually don't know whether you're positive or you're negative on any given day, you either have to be extraordinarily good about taking universal precautions. I have to assume every day I can infect you, and you have to assume that every day you can infect me. And we owe it to each other to do whatever we can to reduce the fact that that's a probability. Because if we can't test ourselves every day, we have no way of knowing who's positive on any given day anymore, because we're not necessarily going to show symptoms. And I think that is an uncertain world now. And again, I feel confident because people have in fact been doing their part. If they hadn't, our numbers would look so much worse at this point, and we would have many, many more deaths, and we would have had the possibility of overwhelming our healthcare system. So I think,
and that's where I want to go with what's going to be my final question before I turn it over to Jessica, who will then take some of the audience questions. Today is May 18th. We began Safer at Home March 19th, hoping to avoid the situations that we were seeing unfold in places like New York City and Italy. And again, through the steps that were taken in Los Angeles, the early action, the hospitals were not overwhelmed. And while having more than 1,800 deaths is a tragedy, it's a fraction of what we've seen in some other locations across the country and around the world. As we look back 2 months later, how do you feel overall about the situation today? Are we where you thought we might be? Are we better or worse? Supervisor, do you want to start with this one?
Well, I think that the reason why we are where we are today is because of what we did. We took aggressive action early on. And I remember when I heard that up north was doing a stay at home, and I thought, how can this be? And the next couple of days later, we did the same thing. We did it in order to prevent from becoming like New York City. We recognize that we have the ability within our hospitals right now. We have an incredible network of public and private hospitals that work together, but we wanted to protect from a surge occurring if we did not do a Safer at Home. So I think that what we did was a difficult decision, I promise you that, because there were many that were like, how can you take away my rights by telling me to stay at home? But we did it in order to protect the public and to ensure that people were not going to be spreading this at the rate that we saw, again, in New York City or even in Italy. I mean, you look at Italy, they weren't even allowed to go out to get essential services. It was a hard lockdown. What we did was we really did prevent lives from being lost by the actions we took. And now people are looking and saying, well, the numbers aren't there. The numbers are not there because of what we did. And we cannot let our guard down. But at the same time, we have to recognize that people are anxious to get back to work and are ready with the knowledge that Safer at Home worked. But at the same time, social distancing is a way of life now.
And Dr. Ferrer, your thoughts on on where we are overall after 2 months of this unprecedented crisis?
Yeah, people ask us all the time, did you imagine that you wouldn't be on the downside? I mean, I think that's, remember when we originally started, we thought, we would very quickly go high and then we would start coming down. And then when we saw examples of what it meant to go high, we were like incredulous, like we have got to prevent the going high part of this. And so I think the supervisor is absolutely correct. You know, there were a lot of hard decisions around closing down, around telling people that they were safer at home, around particularly around closing a lot of businesses. But it was the only way to guarantee that we could actually ensure that we wouldn't have a tremendous increase very, very quickly of cases and people requiring hospitalizations. I do think we did some other things right from the very beginning. We never stopped contact tracing here. That means we never stopped calling people who were positive and had a test result that indicated that they were positive, and trying to either have them or have us contact their close contacts, particularly if their close contacts were in a high-risk population. And now we've been able to build that capacity. We have over 1,000 people that help us with our contact tracing, so that we're able, again, to help people who now are infected know what they need to do to isolate themselves from others. And we're able to find their close contacts and let them know that they'll need to quarantine. When we have more and more people about, we're going to have more infection. And another way we protect ourselves is by identifying people who are positive quickly and making sure that they then are not circulating in the rest of the population. So I think where we're at, it's a decent place for us to be at. It's come at great sacrifice. And as you noted, a lot of people did lose their lives here, over 1,800 people. We're mourning with their families. This is the leading cause of death every day, and LA County is still, people dying from COVID-19. So we do have a ways to go, but I think we're on the right path.
Excellent, thank you. And now we will turn it over to Jessica with some questions from the audience.
Great, thank you so much. We have a lot of questions coming in, so I'm going to try to get to as many as I can. The first question is, for Supervisor Barger. What specific advice do you have for those of us running school districts as to how to open our schools for the fall?
Well, and that is a good question, and that is one that I know I talked to a board member at LA Unified last week is going to be the greatest challenge. It is not going to be a traditional calendar year as it relates to you drop your child off at school and you pick them up at the end of the day, him or her up at the end of the day. They're going to look at how to best protect and provide social distancing, and at the same time give an education. And I know school districts right now are challenged with that, whether it be splitting the day between classes and breaking them up. It's going to be tough. It's going to be tough, and I know we're up to that challenge, but it's not going to be your traditional school as we know it pre-COVID-19.
Thank you. Dr. Ferrer, why aren't case numbers going down with all of us staying home? Are the new cases essential workers?
It's a great question. There are a few reasons why case numbers don't go down. The biggest reason for LA County is the large increase in testing. So the more we test, the more positive people we find. And I really want to thank both Dr. Kazan from the fire department, the LA County Fire Department, and Dr. Christina Galli and her team at the Department of Health Services for ramping up testing from where we started really only a month ago, where we were doing a couple hundred a day to doing between 10,000 and 15,000 a day now here in the county. But obviously, if 10 to 15% of the people you test are positive, and that number has stayed fairly constant, the more people you test, the more cases we're going to identify. And that's actually a good thing. The more people we identify, the quicker we're able to ask people to isolate and find their close contacts. So I know sometimes it's hard as people see the case numbers going up, and you may think like, well, we're not doing something right. But right now, case numbers going up is a reflection that more people are getting tested, and that we in fact can then have people who are testing positive isolate, find their close contacts, and have their close contacts quarantined. So I don't think it's a sign that we failed. I think it's a sign that we've really been able to ramp up testing to the place where it really needs to be. You want to be able to test, between around 2% of your population at a given point in time. That's a number that we would all feel comfortable with. That's about 15,000 tests a day here in LA County, and we've actually hit that milestone, and I think it's just a reflection of the hard work people have done. But it has increased our cases.
Thank you. Supervisor Barger, I think this one's for you. What is the county's situation regarding testing for the public and our stockpiles of PPE for our medical people, and also a little bit in preparation for a potential second wave in the fall?
Well, first of all, and I will admit that I did not realize, but actually, while we're doing the testing at different sites throughout the county, we've got 30 sites up and running. You don't have to go to a county site to get tested. I actually know for a fact in my neighborhood, you can go to the urgent care and they have test kits available, and insurance covers it, and they actually waive the copay to do that. So the tests are available beyond what the county is offering, and so people that think that they have to wait and go to a county site is not necessarily the case. And in fact, those are provided to Dr. Ferrer when the tests are done. The labs provide her the information. So tests are available to anyone that has symptoms or is even asymptomatic. So that is available. And what was the second part of your question?
Just in terms of the stockpiles of PPE for a potential second wave.
So, that is a good question, and that has been a challenge. We have continued to build up on the stockpile for our first line responders, especially in our hospitals. It continues to be a challenge, especially now that the state has lifted restrictions, for example, on dentists, and they have very, very specific requirements in terms of wearing N95 mask after each patient and having to wear the entire suit that they have to wear and for each patient. So I think there's going to be more of a squeeze on our PPEs, but Dr. Ferrer probably knows better than I do in terms of what the current status is, but I know early on it was a challenge, and we were prioritizing for those on the line first and foremost, which includes nurses, doctors, but also fire, police, and sheriffs.
Thank you so much. Dr. Ferrer, when will family be able to visit elderly and assisted living facilities? I know this has been really hard on our seniors, and there's also concerns about stigmatization of those senior facilities going forward. And what is the Department of Public Health going to be doing about protecting our senior population?
Yeah, so we have had a tremendous effort with a lot of cooperation. I want to thank the skilled nursing facilities. I want to thank the assisted living facilities for all of their cooperation. This has been just as devastating for them as it has been for everybody else to watch the continued toll that this takes both on healthcare workers, as well as on patients. And, we do have teams out there. We are now out again for the third time visiting all of the skilled nursing facilities. And we are working, in fact, with the state to come up with guidance for figuring out how can we allow families to have more contact with their loved ones. I know, my father was here actually, and he passed away a couple of years ago, but he lived in he spent his last year in a skilled nursing facility. He was very, very ill, and he was also not able to communicate. And I know how devastating this would be for me if, in fact, I wasn't able to visit him, and he wasn't a person that you could talk to on the phone. So we're very aware of the heartache that this is causing amongst family members of not being able to get into a facility to visit somebody who you love and who actually is probably not doing all that well, because that's why they're in some of these facilities, because they're actually medically fragile. So we're working with the state to figure out what would that guidance look like, so that we could have a safe way for people to actually visit with their loved ones that doesn't increase the risk, again, of spreading the infection. Because, unfortunately, in most of these situations, the residents are bound. They're not actively going out and coming back. And so it's people from the public, visitors, and staff who can bring in an infection. So we're working really hard to not have that continue to happen. But we do need to figure out a way for loved ones to absolutely be able to see their family members. It's one thing to say this isn't going to happen for a couple of months. This can't go on much longer, and we're working with the state to figure out how to do it as safe as possible.
Thank you so much. Supervisor Barger, LA County has done extensive work and studies on how social and economic factors affect health. Are there any concerns about the long-term impact of this shutdown leading to even more deaths in the long run because of job losses, stress, despair, anxiety, and financial instability? What about the upticks in crime?
Well, the short answer is absolutely. I mean, that is something that is first and foremost on all of our minds. the mental health toll that this has taken on many people who already stressed over financial burdens, but then the question is, am I going to have a job to go back to? If I don't have a job to go back to, and then when you turn on the news and you hear about the unemployment numbers, it even creates more anxiety, and we are very cognizant of that. What I tell people is what we are doing is going to impact the very population that LA County is charged with protecting, the most vulnerable, most economically, as well as socioeconomically, but as well as from a health standpoint. So we know the impact that this is going to have. And one of the things that is highlighted is the need for us to really better focus on areas that right now, with even the test sites, we're looking at areas that have socioeconomic challenges to make sure that we are getting it out to them, because many of them are first line workers and that are currently still working. And we need to do a better job, even looking at the numbers, and Dr. Ferrer can talk about that in terms of those that have died. We clearly know that the impact on the minority communities is great. And so we've got a challenge ahead of us as it relates to providing access to services, but also access to jobs and rebuilding the economy for those that are truly concerned about their ability to even get a job post-COVID-19.
Thank you. And this question's come up a couple of times because LA is known as having a great food scene. And so Dr. Ferrer, as a practical and medical matter, how risky is it to work in a hotel or restaurant in LA County now? Are hotels really safer than restaurants, as many are now open? Related, how long would you, Dr. Ferrer, wait until you would eat out at a restaurant, even with limited seating?
Yeah, these are really great questions. And, so the science behind these questions is that obviously if you're in an indoor space, it's much easier for the virus to be transmitted in general than if you're in an outdoor space. And that's why we're so pleased that people, as they're reopening indoor spaces, are paying a lot of attention to the distancing requirements and the infection control requirements, because they're going to be particularly important for the workers. So, some of us, we just go in and out. We go into a restaurant, maybe we're there for an hour or two, but the workers are actually there for an 8-hour shift in general, and the same thing in our hotel spaces. I think the guidance that we're issuing, along with what the Centers for Disease Control has issued and the state has issued, really give businesses the opportunity to create as safe as possible an environment for workers. And I think we all have to understand that that requires some modifications. So when you go to a restaurant and they do reopen, I know that the seating will look differently. And I know that the wait staff will be wearing face coverings. And I know that people in hotels are being asked in all of the public spaces to use those face coverings. And I know that we're all going to be seated in a way that keeps our distance from each other as much as possible. And we have to honor that, because that's a protection for workers who are going to be there for the entire day. And so that's many, many people that they're coming in contact with. So it's really important that we understand why those modifications are happening. And that is what allows for these places to open with more safety than if they opened as they were prior to us understanding this pandemic. And yes, I love our restaurants. I, like everybody else, love our restaurants. And I also have confidence that when they're reopening and they're following all of the protocols and the directives to do the right thing by their workers and their customers, then I too would feel comfortable being back in that space. But I'm just going to remind folks, everybody has to look at their individual condition as well. People who are at high risk because you have underlying health conditions, you might want to wait before you go back to a restaurant, because you actually have a much elevated risk that if you get infected, you could have serious disease. So I think everybody's going to have to make their own evaluations about what activities feel comfortable for them to engage in once we do more of the reopening. And I do always want to highlight people with underlying health conditions, people who are elderly. We owe it to them to help them stay home safely, continue all of those delivery services, please, even as you're reopening, if you're a restaurant, so that people who really need to stay home still are able to do so safely.
Thank you. This one is actually a little bit of a follow-up on the end of your question, Dr. Ferrer. What are the odds of someone under 60 with no comorbidities dying from COVID-19?
It's a really good question. So obviously, I report every day that 92% of the people who pass away from COVID-19 are people with underlying health conditions. That leaves 8% of people who are passing away and don't have underlying health conditions. And that's fairly evenly distributed amongst younger people and older people. And so I remind people, you know, it's good to understand what those percentages are, but it's also good to remember that behind those numbers are individual people's lives. And we have unfortunately lost many people now to COVID-19 who actually didn't have underlying health conditions. The percent of deaths is still small, but it represents many people's lives. And so, you know, everyone needs to be cognizant. Take as much protection as you can when you're out and about. Wash your hands frequently. You know, make sure you're wearing those face coverings, because all of us are vulnerable. The most vulnerable, we know, are people with underlying health conditions. And we also know that people who are older have more vulnerability. But all of us can be in that unfortunate group that really seemingly has no underlying health conditions and no seemingly vulnerability, and there are still people who will die from this disease. So again, you know, protect each other. That's the best I can say, is we owe it to each other to protect each other at this point in time.
Thank you so much. Supervisor Barger, has the county spoken to anyone in finance about when the drop dead date is for the economy?
Well, no, I mean, we're obviously looking at our budget, and our budget shows a $2 billion loss in revenue. You heard the state last week, the governor announced their hole that they have developed. So I think that the reality is that we recognize that our economy is in for a long haul as it relates to challenges and a loss in revenue. So I have not talked to an economist, but I can tell you, just based on our own books, we know that this year is going to be a very different year. And having been a part of 1995 when LA County was truly challenged as it relates to coming on the heels of what happened in Orange County with bankruptcy, we know that we actually immediately took a hiring freeze and put that in play at the beginning of the Safer at Home, recognizing that we knew there was going to be a downturn in our economy. So we recognize that it's going to be a tough year for us. It's going to be a tough year for everybody. Government's just one aspect of this. You talk to people in the private sector, and again, you only have to look at the job numbers to know that we have a lot of people out of work and really questioning whether they're going to have a job to come back to.
Thank you. Dr. Ferrer, how are our hospitals doing? We've heard that some are struggling financially and have had to furlough staff. This doesn't bode well for those who don't have COVID-19, who are taking risks at home by not going to the hospital, or for the future of our hospitals in general.
You know, I think that's a great question, and it brings up a great point, which is, you know, at the very beginning of the pandemic, the hospitals really asked patients not to come unless they had an emergency situation. But the hospitals are reopened now for essential services, and we really need people who need to be seen by either their provider or an urgent care center or an emergency. We need you to come into the hospitals. They're safe places. Infection control protocols are adhered to in all of these settings. People should feel secure in that knowledge, and they should not delay getting care, particularly for chronic health conditions where they may have said, you know, I'm just going to stay away for a while. If you have diabetes and your provider needs to see you, you know, please go and see your provider. I do know that there are some hospitals that are struggling. We're hopeful that everybody will, once they can fully reopen for essential services and normalize their operations, that the general public, again, will start making use of the wonderful services that are available, and they're life-saving services. But what we don't want is to see spikes, as you noted earlier, in other diseases because people have delayed care. So we ask you to, you know, please make sure you're in touch with your provider, and please know that all of our healthcare facilities really are places that take very seriously that obligation to make sure that these are safe environments where you can be treated and treated well for any of your concerns. You know, we have some of the best healthcare in the world here, so people should make sure that they're availing themselves of necessary services.
As a follow-up to that, at what point should citizens start engaging in non-necessary medical testing, like mammograms, annual blood draws, et cetera?
You know, I always tell people, you need to talk to your provider. They're your best source of information about what you need to do to take good care of yourself. And we leave a lot of decisions up to that provider-patient relationship. But I consider mammograms essential. So just to go on record, like these routine tests, they save lives. So please, talk with your provider if you need to get some routine testing. These are routine tests because we know that they're really necessary for either diagnosing or helping with a treatment plan. So I consider that essential. And but I ask people, talk with your provider, find out what the appropriate schedule is for you. But when I talk about essential services, I am talking about all of those prevention services that help providers take the best care of us as possible.
Thank you so much. Supervisor Barger, what is the status of COVID and our homeless population?
Well, I pre-COVID-19, we were already having difficulty getting shelter for individuals out on the street. With COVID-19, we recognize that they fall into that vulnerable category. They fall into a category that is susceptible not only to getting the virus, but also spreading the virus. So through the state, we've been very aggressive in our Project Room Key, identifying motels that were willing to negotiate a lease and allow us to house these vulnerable individuals, including services, both food, mental health, and also security. So we have moved mountains. We've got a long way to go. We're working with Judge Carter, federal judge right now, on a court order to remove those from under the highways and freeways. So we are moving, not as quickly as maybe some would like, but I would argue that pre-COVID-19, these individuals would have still been on the street, and we've been able to house them successfully. And post-COVID-19, the challenge is going to be, how do we keep them from ending up back on the street? We have an opportunity now with services being provided to move them into more affordable housing. I'm confident that as a group, both with the city of LA, but also with the other 87 cities, we will be able to do that. But clearly understand that anyone that's homeless is already at high risk. And if you look down at Skid Row, and Dr. Ferrer knows this because she's been down there and seen it firsthand, that population down there is perfect for spreading this virus. So it's important for us to identify and get off the street as quickly as possible to stop the spread, but also to prevent deaths, because again, they are the most vulnerable with pre-existing health conditions, and we all recognize that.
Thank you so much. Dr. Ferrer, this person says, I am the HR director for a nonprofit organization in downtown Los Angeles, and we are preparing to return to the office soon, taking the necessary precautions, of course. What advice can you provide to help ready the staff emotionally and prepare from a health and safety perspective?
Yeah, thanks so much. So the first thing is we do have protocols on our website. So I would urge folks to look at the guidance we've already issued for all the businesses that are open. So you'll have a sense of how to best think about the two buckets we need everyone to pay attention to: infection control, what can you do to minimize the spread of infections, and then the distancing requirements. But I like this question because it actually acknowledges the emotional feelings that people have about A, having not been at work for a while, and B, about their concern about being safe when they return. And I know for many folks, because I get emails from people, they are concerned. They know that they want to go back to work, but they are worried. They feel like they're not really sure how safe a work environment can be. And I get I know there are questions about we're not opening fast enough. I also get questions about, are you sure that this is okay and this is safe? I like it that our HR directors are paying so much attention to the issue around trying to reassure people that we're doing everything we can to create environments that are as safe as possible. And it still requires every worker to do their part as well. We still need people when you're sick, you still need to not come in. Please don't start spreading germs unnecessarily because you feel some compulsion to come into work even when you're not feeling well. The work environment, I think as Supervisor Barger noted, it's going to look different. We're not going to have people crowded together. People are going to need to spread out. They're going to need to, again, perhaps make adjustments. We're not going to encourage that those lunchrooms where we all went and hanged out and we ate together, and those are things that right now are not the safest thing for anybody to be engaging in. So I think we're going to see these changes all done to try to provide as much assurance to employees that are returning to work about the safety. And I would say the other part of this is I've been so impressed with our labor partners who have worked on these safety committees with management to actually outline their concerns with the management teams, and then together do the problem solving about how to make this work in particular sectors or in particular businesses. Those partnerships have been instrumental to date in opening up in some sectors like manufacturing, where people have really worked hard with the labor partners to actually create environments that reduce the stress that many employees feel when they know they have to go back to work.
Thank you. And a number of people are asking for those resources from the county. So the World Affairs Council will send a follow-up email to everyone, and we'll include those links. So hopefully that will be helpful. I think we're at our final question. I apologize. I know we had so many more, but I think Dr. Ferrer, this one would be for you. Do we have evidence that people who have had COVID-19 are protected against being reinfected?
We actually don't have enough evidence to be able to make that statement right now. And, I wish we could. I wish we could say that once you've developed antibodies to COVID-19, you're protected, and you're protected for this amount of time. There's still a lot of researchers that are out there trying to figure out the answer. There have been some cases where people have tested positive, been ill, recovered, and then become what you call reinfected. It's not really clear yet if these were, if they never really fully recovered and maybe the infection was there all along, or if they in fact were reinfected. But we do tell everybody, until we get the evidence, even if you've been infected and you've recovered, which is such a good thing, or you had an antibody test and it said that at some point your body saw this infection, developed antibodies, even if you never got sick, that neither of those right now allow you to feel secure that you can't get sick again. And then that means that it also doesn't allow you to say, I won't be able to get infected and transmit the infection to other people. I know the researchers are working really hard to get us answers to these questions. And again, we try to give that information out as quickly as we get it from the scientists. So we're just going to have to wait until there's more evidence about what kind of protection you have if you've been sick. I will note, in most other viruses, you have some protection. And for some viruses, you have protection for quite a long period of time. But we do have examples where you're not actually all that well protected. So we're going to have to wait until we get the research.
Thank you so much. We're actually going to be doing an event next Tuesday with Caltech with some of their biologists who are studying the immune response. So hopefully we'll have a little bit more information next week that we can share. But thank you so much. I'm going to turn it back over to Jon. Thank you.
Thank you.
Great, thank you. And this has been an amazing event. A lot of smart questions from our viewers. We've covered so much territory today. Once again, Supervisor Barger and Dr. Ferrer, I want to thank you for your time, your insight, and your leadership, but also your transparency, your consistency of communication, and your honesty. I think I can speak for all of our audience as we give you a very enthusiastic, albeit virtual, round of applause. So thank you.
Thank you.
Thank you again to the Los Angeles World Affairs Council and Town Hall. And with that, I'd like to kick it back to Kim.
Thank you, Joe.
Thank you.
Supervisor Dr. Ferrer, Jon, thank you for such an informative discussion. We so much appreciate your time and, as Jon said, your leadership and your transparency. So thank you. Keep doing what you're doing so very well. And thank you to all of our viewers for joining us today. In addition to our programs tomorrow, Wednesday, on Hong Kong on the Brink and Dan Schnur's Politics in the Time of Coronavirus, we have a terrific lineup next week. Jessica's already given us a little scoop on that. On May 26th, how Caltech and JPL tackle a pandemic, with a phenomenal panel led by Thomas Rosenbaum, president of Caltech, who will be discussing what they've learned about the immune system, the environment around dramatic changes in human behavior, and how to use JPL's tech world to build ventilators. On May 27th, we joined the World Trade Center LA to present their 2020 Foreign Investment Report that covers the state of California. May 28th, we have Dan back with Politics in the Time of Coronavirus. And then we have a really special program for you on May 29th with the RAND Corporation on truth decay, focused on facts and disinformation in the new normal, with Michael Rich, President and CEO of the RAND Corporation, Jennifer Kavanaugh, who's a senior political scientist at RAND, Donnie O'Sullivan from CNN, and moderator Pete Peterson, who's Dean of the School of Public Policy at Pepperdine. And if you look on your control panel, there's a tab that says handouts. So if you click on that, you'll see all of our upcoming programs. Please go to our website at lawac.org to see how you can support us so we continue this wonderful programming like we had today. Please, everybody, stay safe, stay informed, and we hope to see you soon. Thank you, Supervisor. Thank you, Dr. Ferrer. Thank you, John.
Thank you, John.
Fabulous, just fabulous.
Thank you.
Kim.